John Coombs here with James Wilson, Dr. James Wilson. James, I understand that the adrenal quartet system you use is very helpful for women with menopause.
John, I was surprised at that. I didn't design it for that, but I was surprised because we started getting women coming back and saying, oh, my PMS is so much better. And when I started, and then my perimenopause was better. Then my menopause is better. And I started looking at that. And of course, then I started understanding, oh, of course, the adrenals has more than 50% of the testosterone. It has about 40% of the estrogens and the progesterone. And so no wonder that they're getting such relief. As a matter of fact, then, over a period of about 3 or 4 years, physicians and pharmacists led me into a new understanding of, if you're going to look at perimenopause, PMS, and menopausal women, look at the adrenals first before you look at anything else. And so they actually gave me the feedback that they were using a program like this, that the first thing they did when a woman had PMS, menopause, or perimenopause is they had them take the adrenal fatigue questionnaire, and if they were low in the adrenal hormones, then they had them take these salivary cortisol hormone test, and then as they treated them, they watched them come along, and it was much more satisfactory. Now, the compounding pharmacists use a lot of hormone replacement, and what they found is they could use much less if they were treating the women for particular conditions, which they usually were. They could use much less over time of the hormones, and sometimes drop the hormones altogether. Other times they'd only need a tenth of what they were using, because once the adrenals are working more completely, they didn't need to add them. And you can see, if you're a compounding pharmacist or your doctor trying to treat hormones, they come in, oh, it seems like she's low estrogen, so let me give her some of that. Oh, seems like she's low progesterone, so I'm going to add that in there. Oh, maybe she's a little DHEA. Let me add some DHEA in there. Now it sounds like she's low testosterone. Let me add some low testosterone. So it's a little bit like trying to treat a wagging tail on a dog. They're trying to mix this and match this and trying to balance this here. They're like a juggler. So once they started treating the adrenals, it makes all those. They said, my job just got a lot easier. As a matter of fact, I'll never forget an OBGYN that came up to me at a conference, and he says, you made my job a lot easier and a lot better. And I said, I did? He said, yeah. The last lecture, you talked about the adrenals and how it could be effective in helping people with menopause and perimenopause and PMS. So I thought, I'll give it a try. He says, I can't tell you how it simplified my practice. It's made it so that I have that as a primary way that I start treating it, and then after a couple months, then I start adding, if I need to add any hormones at all. And not only am I treating more pervasively, that I'm treating now the whole person instead of just the signs and symptoms of this hormone, the signs and symptoms of that hormone. I'm now treating the more complete person, and it's a lot more successful. I've got a lot more happy women, and what I'm finding is I'm taking care of signs and symptoms the women didn't even realize they had before they came in.
So by treating the hormone, the adrenal glands, the body is then naturally producing the various hormones that are necessary to deal with perimenopause or menopause.
Absolutely.
Brilliant. Very exciting. Thank you very much, James Wilson. www.adrenalfatigue.co.nz or www.globalhealthclinics.co.nz.